All right, so it looks as if I'm relegated to this mic as well. So when Gil and I were mulling over what should the future of Eyecelerator be, as we were looking at different ways that we could expand the program, we recognized that there was a real opportunity when we thought about partnering with ARVO to bring that whole ecosystem of the basic science, the university environment into closer proximity with what was happening in the innovation space. And so this particular session becomes, sort of our exploration of that. And so what we wanted to do here was really to have a discussion about that pathway that takes people and ideas from the academic environment all the way through to products and that are actually making their way to patients. So, we put together, I think, a really eclectic group for this, and I just want to introduce the group that we have here. We are in Colorado, so we've got Gali Baler, who's the Managing Director of Strategy and Operations at Colorado University, or CU Innovations. So he's the operational backbone behind the $110 million CU Healthcare Innovation Fund and multiple grant funding programs. We have my good friend Doug Fisher, who's a partner at Revelation Partners, 20 years of investment experience, focused on biopharma, diagnostics, medical devices. We have Babak Nemati, who leads the externally facing functions of the Alcon Seed Fund. So Babak oversees opportunity identification, due diligence, investment recommendations. From UCSF, we got, which is my home, Mike Papac, who's head of Ophthalmic business development at UCSF Innovation Ventures, where he supports the commercialization of UCSF-developed technologies through startup business development and IP portfolio management, and we like to think we've got a big portfolio. We've got Firas, Rahhal, who's the partner at ExSight, senior partner and executive committee member at Retina Vitreous Associates in LA and at UCLA School of Medicine. And we have Namrata Saroj, who brings over 25 years of global development and commercialization experience, including pivotal roles in Lucia and Eylea. And Namrata currently serves as Chief Business Officer at Ocular Therapeutics and Principal of All Eyes Consulting. And then also from her time at UCSF, when I was there, Christine Winoto, who is founding partner for MedTech Venture Partners. And so Christine was also the former deputy director of QB3. So QB3 is a really interesting consortium in the Bay Area. So it's a partnership between UCSF, UC Berkeley, and UC Santa Cruz, and it's really focused on life sciences innovation and entrepreneurship. And so you can see there's really the full spectrum of experience here. And so for those in the audience who have wondered how are you going to make your way from that aha moment in the lab to patients, that this is the group that will help you get there. So let's see. Hopefully, is this working yet? I think I'm going to be standing. So Gil, I'm going to have to lob these things to you, but I'll get started.
Let's see. Mine's working.
So I'll get started. So what I wanted to do to frame the discussion again is there's a sense sometimes that the university sort of lives in its own world, and it's so separated from where the real action happens, which is in industry. But there's a case to be made for the role that the university plays. And so I'll start with Gali. So how much of a player is NIH funding and university-based research for the innovation pipeline across all of pharma and MedTech?
That's a great question to lead off with, and I think it does help set the stage. If you trace back all the science that comes from the technologies and the companies that are either rebranded or recapitalized at the later stages in the public markets, a lot of them can trace their roots back to NIH-based foundational science. Between 2010 to 2016, of all 210 molecules and therapeutics approved, can anyone guess how many based their early research on NIH-founded science? It's all of them. So if you go back, it all really starts with NIH. It's a massive portfolio of pre-seed technologies that helps move technologies all the way to the patient impact.
Gil?
You know, I have a question. Maybe I'll start with Christine, but it's very hard as a venture capitalist. I'd say one of the hardest things is getting entrepreneurship out of an academic institution on both sides. What kind of incentives are there to encourage people or even reward them within academics? When I was coming up through academics, it was actually very difficult and discouraged to be an entrepreneur. Was a bad word. Now it seems like a good word. What's your perspective on it today?
Well, thank you for that question. I think what comes down to three things. Incentive is one, environment, and leadership. So let's start with the incentive. I think everybody in academia really value the real world impact, but day to day, they're always measured by their grant and publication. So I think there's also an opportunity to recognize not only what they produce, but it's also the people that they develop. I think when you develop the measuring that is important, that translates to, all these people who are going to build a company or bring the innovation to a real world. The second one is environment. And I think many of the systems focus on creating an environment that is successful for faculty. But I think a lot of the time we need to be also intentional about paying attention to training the students and the fellows. Because oftentimes many of the innovation are brought to life by the students. And the other things that I think is also a lot of a system that I think is successful, they create a protected space where people can test their idea quickly and also have access to the real world to give them the feedback. And I think at the end of the day, those people can develop their execution skill when they have given the opportunity to build and iterate. And the third one, I think, is leadership. I think many of university faculty are trained to be a great researcher, but oftentimes they're not being trained to be to lead and develop their people. And I think that's another thing that I felt that is important. Innovations, not only need space for some autonomy, but it's leadership actually, I think, that give the energy and also give the direction of the people. And at the end of the day, I think that's what it is. So I think in university, I feel like the challenge is not ideas. There's plenty of ideas, but I think it's hard to, but I think investable idea, I think that is difficult. And so, but I feel like if you provide that kind of encouragement to a lot of the people who are willing to make a difference, and then give them that created safe space, but also allow them to build new ideas and find a way so that their idea is going to be supported by outside people. So it's not so much just by the inside people. So that's in a nutshell, I think.
Yeah, so it's interesting because really what that brings up is that typically out there in the rest of the world, you pretty much just have two parties you're dealing with. You got the innovator, and then you have the marketplace. And in this environment, we're talking about the innovator, and now they've got their institution and they've got the marketplace. And and a lot ends up having to be negotiated. There's a lot that basically the faculty members and the innovators just don't understand. So. And one of the fundamentals, sort of getting to the nuts and bolts, and so, Mike, this is one of the big issues that you have to deal with. How do institutions, first of all, when confronted with, opportunity, think about going all the way with it or just saying, look, we're going to find a partner, and we're going to license and sort of get out of the way?
Well, thank you, Steve. That's a great question. I think from the university's perspectives, universities are large organizations, large administrations, and they're driven by their metrics. Those metrics, however, they're looking for a number of licenses and revenue. And when faced with an opportunity, I think historically looking at the number of licenses was a bit short-sighted, and I think that's what's happened over the last 10 years is there's been a shift from really just trying to administrate licenses to trying to figure out how do you actually set up these licenses to be successful, because a license is not successful, it doesn't generate any revenue if there's no product or service that gets to market. And so I think that's one of the key things that most tech transfer offices have become innovation offices over the last 10 years. You've seen that. So not only do they manage the IP associated with the inventions, but they start bringing together the resources in order to support incubation of some of those technologies while they're still within the university, and support them even after they've spun out. So and there's a wide range of things that can happen that I could probably talk your ear off about.
Yeah, I mean, I do think there's been the sense that there's a fundamental shift between these, tech management offices that first really just sort of operated as cost centers. They had, there was a certain amount of, business. They just had to get everything they touched meant they were generating cost, and they really weren't tied to the revenue on the other side. And now I think there's really much more of a sense that they can actually be and have to be profit centers. Gil?
Great. So let's move forward and say we've found something in a lab that seems exciting and might be investable, and now we're going to say, okay, we're going to go into startup mode and maybe license it or find some funding for it. Are there any one or a couple top obstacles that you typically come up against? Maybe Namrata and Babak, you guys have done a lot of this. Give us your thoughts. Maybe we could open up to the panel on that.
Yeah, thanks, Gil. I think the number one thing I see is not understanding the landscape. When folks are working in labs, and rightfully so, they are in their little echo chamber. I think really understanding the landscape and developing the product to address that. What is the unmet need? If you are going to come up with just another anti-VEGF in the retina world right now, it's not going to be successful. So what is the unmet need, how you can address it, how you can refine your product to do that. And I wanted to touch base on sort of the institution aspect. I think, and I'm glad to hear that there is a shift, because the tech transfer offices would actually limit the innovation because they would put so many obstacles that the poor scientists who have such great science cannot actually be successful because of bureaucracy. So it's good to hear that that aspect is changing as well.
So that's a great setup, actually. I think assuming that the translational considerations are in place, which means, basically good science is necessary but not sufficient, that there needs to be really a product element or a product opportunity there. So as my fellow panelists just mentioned about understanding the landscape and where it fits. Assuming all of that is in place, some of the big issues I see, obstacles, number one is funding, especially if you're developing a medical device opportunity. As I think there were conversations earlier in the day, the funding climate has been very, very difficult. So for you to be successful, you need to have a team that can navigate that process very creatively and aptly. That's one. The other one is team building is often the hidden obstacle. So oftentimes opportunities in the universities are founded by incredible scientists, but you need the complementary operating skills to be able to essentially not just create the company, but build that company. And the other common issue I see is a good appreciation of the value of IP. So invariably, when I talk to academicians, we ask about IP, they say, oh yeah, we filed the IP. But filing the IP and commercial value are two different things. And in fact, I often see that people relegate it to their patent attorney, and the patent attorney says everything's going fine. I think what I'm interested to hear is if the litigators looked at it, because in reality, the patent process, as many of you know, is a dance between the patent prosecution attorney and the examiner, and by the time it's allowed, much of the value of the original claims may have been diluted down. And last but not least is alignment of the stakeholders. So the scientist, the clinician, the tech transfer office, the investor, the industry partner, they all need to basically move in the same direction. And oftentimes, if there's friction or some divide in that kind of a series of stakeholders, that could undermine the progress of the company. So some some ideas there.
Sounds like it's a miracle any of these things ever get off the ground. It's a long list of things. Great. Stephen, I think you had next question.
So, just a couple of questions I'll follow up on. Gali, what do you think are what would you say are the risks and benefits of really an institution that, because CU has a big fund, using its own funding as opposed to looking very early on at partnerships, pharma or MedTech?
So when we think about how we construct syndicates of investors around the opportunities, our fund is a little bit unique, and we've scanned the landscape across university-based venture capital funds, and many of those that are captive to universities only invested in their own intellectual property. And so because of that, the pool of opportunities are limited to just that institution. Now we're trying to create a diversified portfolio of investments. There's maybe not enough investable opportunities that would create a return for those LPs. In our fund, we actually have outside venture investors, about 83 LPs, including the institution and the 2 hospitals that we have to manage as well. And so our thesis is, by leveraging the campus, how can we add value to the opportunities, some of our own intellectual property, but as well as other companies that are coming in to partner with the campus in a meaningful way. So for our investment opportunities that come out of the campus with our own IP, the requirement for our own faculty is to come to us with a strong lead investor, an outside syndicate partner that can drive the valuations where we're not going to value the companies ourselves. And so that creates an onus on the faculty members to make the kinds of networks and connections, to build the teams so you can create a venture investable business and put the onus on them to come to us with an opportunity that we could then invest in. That also helps insulate our fund from investing in, doctor has lots of influence within the institution to invest in technologies just because there's a fund associated with the university. And so from the framework of who are those other syndicate partners, our trifecta of great partners are other healthcare systems, strategic investors, as well as venture capital investors in that space. From the pharma perspective, having the participation is great, but one of the things we have to consider is when the relationship occurs in the cycle of the company, what are they partnering on, and then what are the specific terms around that collaboration with the pharma companies. The challenge is they may have a lot of benefits and pros on the regulatory development pipelines expertise specific in that field and area, but some of the challenges may be the opportunities for liquidation on the back end that fit strategically with a particular pharma company or partner may not be aligned with the venture creation of the business itself. Conversely, when we're looking at venture investors, they're really scouting for technologies to build a company around. And so there may be a little bit more dilution from an investment perspective, but a little bit more in terms of support from the venture creation side.
That's a very interesting. So Mike, I guess that because we've really got 2 university systems represented here, any perspective on that, and any additional things that you tend to think about when you're thinking about approaching startup partners or strategics?
Well, I will say that I think everything that you said resonates, and the key aspects that really resonate, I think, is setting up the right incentive structure for the organization, in particular around the team, right? And I think the teams are what we're looking for when we see opportunities. Not only is the technology and kind of where it is on the readiness scale, but is there a team that's coming together around that technology that can really help drive it to become a successful product or service. And I think that's critical. That also influences the ability for that opportunity and that company that spins out to fundraise, just as you said. Now, we don't have maybe necessarily the same structure that you have in our organization, so we lean on a lot of, we'll call it investors from the outside, a lot of venture from the outside, and we've been leaning, I'd say that was successful maybe 5 years ago, and I think that's become less successful over the last 5 years just because of the environment. And so what we've seen is a shift towards strategics earlier engagement of strategics. It's become a critical role. Babak and your team have been very active in the space, and we applaud that. We'd like to see more of that. And I think the other thing there as well is foundations. Foundations are starting to really even generate create their own accelerator funds. And that's good because it helps bridge the gap for technologies that may be a little too early for most, we'll call it venture investors to come in. And that's what it takes in order to get things off the ground.
That's great. I wanted to ask a little bit about investability. So I think it's one of the hardest things, and I could say from at Interwest Partners, our venture fund, which has 40 years of history, before me, 10 funds, 4 generations of partners. We analyze our data, we do it every few years, and it's always the same. We lose money on half of our investments in every single sector, IT, life science, biotech devices. So we're only right at most half the time, and it's really just a few companies that really generate all the returns that have allowed us to be successful. The hardest possible thing is doing early stage, and the only thing harder than that is going into an academic environment and trying to do an early stage. So and maybe for Doug and Firas, who have checkbooks to go in and invest in this area, what do you guys look for investability? How do you look at it?
So Gil and I did this for a while at Interwest. It is the hardest. By the way, you're really good if you're right half the time. So that's one of the little secrets. So what are we looking for? A lot of it you've heard in different ways from the panel. I'd say we structured it a little differently. The first thing that we're looking for is, okay, well, what's the unmet need in the solution that you're coming with? How does that fit together? The second thing is IP, but I will second what you said. IP is a journey. You need some of it to start, but it evolves as the company moves forward. 3 is the team, as you were saying, and it's who's the founder, who else is involved, how committed they are to this, how much time can they spend. And then the 4th is, okay, well then how much money do you need? And what are you going to do with this money, and how long is it going to take? And the earlier you start, the longer it's going to be. And the more institutional capital you'll get if you have something that's been able to get a little further along on the academic side. But I'd say that's our focus in flipping around how certain people here are talking about things. Though I will say, as you talked about thinking about pharma versus investors, I think they can actually work together very well. If you just bring it right into a company, well, the company has tons and tons of programs going on, and you're one of many. From the entrepreneurial side, you have a lot more control, and I'll say it'll be worth a heck of a lot more to the institution if the company's successful.
Firas, do you have perspective on it?
I agree with everything that was just said, and I think the focusing on the team and the management team building in those early stages, which is challenging because there's no real money and no real team. It's a founder with a lab, and that critical early step, and we might get into this later about when to spin it out and when to have management come in, and do you have enough money to do that latter step, which is bring in credible management, and or can the founder, him or herself, be the manager and the chief operating officer all under one hat. These are big challenges. So I think obviously the asset has to be analyzed at the highest level, but that becomes a binary question much later down the road. It either works or it doesn't work. The controllable factors for the investor might be, what do I think about this team or the team that could evolve out of this program, and how could we influence that in a way that increases chance of success?
Yeah, that's a great point, and I just want to amplify that a little bit, that the team at the early stage, a lot of it is a decision. The faculty member or inventor, what role are they going to play? And do they want to take it all the way and be the CEO, which some of them have been able to do that successfully, or are they more want to keep doing what they're doing? And I'd say our Interwest experience has been that any different model could work, but it's what's the old Clint Eastwood thing? Man's got to know his limitations, that people have to have insight into what their skill set is, and that's ultimately might be more important than what the IP licensing deal is with the technology office.
Yeah, so you know, it's there's this old adage when you think about sort of that potential you know, clash of culture between, you know, the academic institution and, you know, the world of commerce. You know, there's this old adage that, you know, universities take money and turn it into ideas, and you know, and the world takes ideas and turns it into money. And, you know, the place where those two cultures immediately collide is coming up with the IP and the licensing strategy. And, you know, the institution may want one thing, you know, the partner may want another thing. You know, Gali, how from your perspective, because I'd love to hear, you know, sort of what the institutional side sees, and then you know, what the industry side sees. So Gali, first from the institutional side, you know, what is driving an institution's IP and licensing strategy?
So from our perspective, the mission of the office, which we recently recrafted, is to try to accelerate technologies to patient impact. So nowhere in there is there revenue targets for the office. Now, if we create technologies, and I think, Mike, you said this very nicely, if the technologies that we're investing in, both our P budget, and we have a certain limit of dollars, we can't invest infinitely into large portfolios, turn into products that improve lives, that generate revenue, that comes back in the form of royalties, that benefits the institution, it benefits the entrepreneurs, the researchers, and their mission to create larger impact beyond just publications. That's a success, I think, for everyone in the ecosystem. So it really helps level set the perspective from, we are at the front end of getting a license over the finish line, and a $5,000 to $15,000 upfront payment, if that's all we ever get, is a failure. So we really have to think long-term about the milestones that we embed into the licensing agreements, the flexibility that we should consider around things that have to change and pivot over time to make sure that we're creating companies that have a strong, flexible IP strategy and license that can enable them to be successful. I think ultimately the best IP strategy is one that allows a company to flourish in the space. If it's too restrictive, nobody wins in that sector.
Yeah, that's good. I think you're a particularly enlightened university-based person, because I think in the old days it was too focused on the royalties up front and not enough on the bigger picture and equity and so on. But I think now the industry is getting much more sophisticated, as you are. So from an industry perspective, so the university wants to maximize their economics. If you look at it from the industry, maybe Namrata, you want to comment on this. What, you know, these licenses or royalties, and how does that affect you? Are some of these deal stoppers for industry, or do you have to renegotiate, or how do you look at the industry impact of the deal?
Yeah, I think it all depends on the stage the company or the asset is at as well. But just stepping back, I think, you know, the big difference is you're changing from an academic mindset to a commercialization mindset. And that's what the company is looking. The company is coming in to get an asset to eventually commercialize it. So there is a drug development process, but the end goal is very clear. So the couple of things that a company is looking is, of course, first the unmet need, as we all keep talking about. You also want to look at how scalable is this product. Right? Is this product going to be a very niche product? Are we going to be able to scale it up for the masses? And eventually, what is going to be the commercial platform? I keep going back to commercialization because even from industry perspective, when we're talking about internal drugs and talking about a development plan, commercial has a seat on the table now. You can't separate the two things out. So the royalties, the licensing will all depend on where the asset is and what impact it will make for the portfolio of that company.
So one of the questions that I think is also one of those things that has evolved over time, I think it's been alluded to, is the whole strategy of pursuing a royalty agreement or considering equity positions. And so, Christine, have you seen that change over time?
I think my colleague in university probably will have a better answer to this. But I think definitely, I think more and more academia is utilizing equity, which is, I think, is great. You know, the more tool you have, the more flexibility. As oftentimes you're a startup, you don't have cash money. And there's still always cash portion. I think whenever somebody license, you know, faculty have to spin off their IP because they have to pay for the maintaining of the IP and all good stuff. But I think I can totally understand there's that push and pull, right? University need to cover their costs, make sure, especially if you're a public university, you have to kind of answer like, hey, we are not here to favor somebody, but really get something, not just, being at QB3, we used to get a funding from the state. We always have to remember that we are not playing favor because we are using tax dollars money. So there's always that image that we, the optic that we have to pay attention to. But I think it's a good thing. So, but of course, I'm going to say something that I always envy the folks in Australia. I thought that's a really interesting model that, because, being at university, everybody always complaining about their licensing office, because, faculty always have to negotiate. And I said, wouldn't that be easier if everybody have standard for if you're this size market, then everybody get the same, and then it saves everybody's time, but nobody wants to take that.
Yeah, that's right, because it's one thing, and that's one of the challenges that you have in the institutions. That sort of the faculty member sees one thing, and the whole institution sees something else. So for us, so you have a faculty member at Colorado who is looking at you for advice and says, look, there are different ways that we can. What should I be arguing for? Should I be pushing the institution for the equity position, or should I just take my cash and take the royalties?
Cash is always good. Cash is king. Somebody said that 4,000 years ago, I think. I like the way you framed the question because Babak mentioned this earlier, and I've been thinking about this in terms of the three stakeholders again. And again, there's the investor and the founder/innovator and the university and or their tech transfer office, those three camps. And historically, and although things may be changing in some of the technical aspects, those are still the same three camps. And what I've seen, and I think historically probably common, is ironically the founder may have more alignment with the investor that they've just recently gotten to know, because it's kind of going to be their job, along with some attorneys and the investor's attorneys, to go down and beat down the tech transfer guys' numbers, because the type of win, whether it be equity or royalties, and we can get into that for a second, probably matters less than the magnitude of either. So if you want to ask if the university sits on royalties, and that's the most common still, I think, by far, and they're going to be in the 1% to 3% range as opposed to, say, the 5% to 10% range, that's going to be favorable to the investor. And it may start at a number, and the founder, if they're acting in their best interest to make the product sellable to an investor, not so much to exit yet, would fight for that, and I think needs to learn or get help in how to negotiate that. He's an expert in this, and I've not sat in those negotiations, but that alignment is there, and I think ultimately the alignment of everyone is there if those numbers fit, because you got to be able to raise further money around this. And if you have a bunch of people with large stakes on the cap table or large royalties that are scary to subsequent investors, that's a problem. So royalties, I think, to me, for the universities still makes the most sense early on, with the caveat that later on, Series B or beyond, that can become a little more complicated for exiting to an IPO or exiting to an outright purchase from a strategic. And that can be negotiated early into becoming convertible into equity in those later stages. And so the alignment's there, but I think the alignment is probably strongest between the founder and the VC in that very early stage. They're both trying to keep the cost down.
I can add a little to that, which is, it's actually a lot more standard than I guess it appears on the panel at the moment, at least for a lot of the companies I see. So UCSF and Stanford are the ones that I license out of the most often. And yeah, they'll push on different things, but the basic structure's there. UCs, I've actually found, have a template that some of them use, which is very useful, and I argue this to all of them, that they should all have a template, everyone on this panel. Just have a template, because it's going to average out over the vast amount of companies you out-license.
But as the investor, we don't want the average. We want the best day you can give me that day. That's nice for everybody else.
Deal, but I have found it to be rather standard as to what what it is coming out, and it's just more a recognition, which I think most universities are having now, that the equity will be more valuable to them if the company is successful. And there are usually some small royalties in there too, which are fine. And a lot of it really comes from big pharma of what they'll accept, 1 to 3% royalty, they can handle that. So but I do agree with one of your other points, which is we are most aligned, the investor, with the entrepreneur. Once the money goes in and that initial cap structure is set, we are basically both want the exact same thing. And I find once you've dealt with the university in the beginning, it all will be fine after that. That's the toughest part of the negotiation, but it is getting fairly standard as to what those terms should look like. For everyone listening, if you're thinking about trying to out-license something.
Still beat them down.
I mean, the other consideration for us too is we distribute revenues from royalties back to the inventors. And so researchers and faculty have multiple different hats that they're wearing. At the beginning, if they're not going to take a role in the company, they want that license to be as valuable as possible because that's the only way they're going to get paid. If they take a role in the company, they also have an equity stake as well as the inventor share. And so they're going to create more value probably on the equity side than the technology itself and the IP. When the technology gets licensed from the startup company to a large pharma company, maybe taking on the phase 3 trials, they don't want that equity to be, that royalty to be low, because again, they get paid back on the downstream benefits. So their role, their responsibility, their economics change over the lifetime of a technology. And we're trying to educate faculty around the life course of a technology and the life course of researchers and innovators' careers. And I heard a very sage venture capitalist say that the deals are many, across the lifetime of a career. So don't be hung up on one particular one. Just keep innovating and coming up with next technologies and improving upon the stuff you created before.
Yeah, I just want to add to that. I think what you said is really important, that the roles change as the process goes on. So for the founders to be flexible, realizing that what you're doing today, somebody else is going to be doing that better, and it's okay because you played your role. Get the right people in for the right job.
This is really an important part of the conversation, I think, and for the audience, I think maybe I'll throw out a sort of concept, which is the royalty burden on a company, and I think we've sort of been talking about that in this. And there are incentives. I think the history of university licensing was that it was mostly royalty-based. People didn't want to take the risk on equity. More recently, there have been some very big successes of Spark Therapeutics, for instance, and gene therapy for UPenn, where the equity part was so dwarfed what the royalty would be, I think, in that case. And so there's an opportunity to mix the model, but I think for entrepreneurs to be sensitive to this royalty burden, I can't tell you how many times. Well, Doug is actually the expert on this. When he first came to Interwest, he was one of our partners there. One of his projects for our senior biotech investor was to reduce the royalty burden of some of our biotech companies, because they had, remember, it's not just one license they might be doing. They might have 10 different universities, and it became unfinanceable that the royalty burden was 20% or something. It was unfinanceable. You might comment.
I would add to that, and it becomes unfinanceable because then you can't sell the company to anybody, and you'll end up at the end of the day, the buyer, whether that's a big medical device company or a big pharma company, they're going to come in and they're going to tell you, we'll buy this, but you got to fix that. And that's going to go all the way back to academia to say, we are not selling this unless you drop that royalty to, and it's definitely under 5. It's usually 1 to 3. And that's kind of where it always ends. And that's what I'm saying. The standards here are pretty well set, at least from the acquisition perspective. So it'll get there one way or the other. But it's better if you can beat them down in the beginning.
And that
was my job that Gil gave me.
Comment to end there, but I think there's a lot of start points that start above 3%.
Some do. Yeah.
But I do think it's university specific, private versus public, and I'm not an expert in this area. I don't know. You guys have a template you go with every time the same way? Everything's negotiable, though.
We're working towards the buy now button, where you can just add it to your cart and it'll be fine.
That's it, Instacart.
That's right.
Bezos is out here somewhere, isn't he? Buy a company.
So, Gil, I think this rolls into the question that we had up for you.
Well, I think we're going to ask this to Doug, but maybe to anyone here is, when is it worth it? What institutional constraints are you willing to work with to do this, or do you just say, "Forget it, I'm going to go find another deal"? When you're looking at something in an academic setting, is it
I could start
Yeah.
from the investor side. And this is where it actually gets into the kind of things that I was talking about, which is how much money is this going to take, right? And how long do we think it's going to go? And you can be flexible. If you've done this for a long enough time, you realize how things are going to change as the companies evolve, right? So what'll I push on most? I'll push on royalty. Equity is very easy to give in the beginning because these companies are going to need more money and more time. So here's a question. Gil and I probably have seen, 300-400 companies over our careers. How many of them do you think were on time and on budget? Just yell it out. Not zero. It's not zero. 1%. 1% of the companies Gil, would you agree with that?
You know, I think I just learned to look at the projections and take the square root of the revenue projections and move it back 5 years. And I was still wrong half the time.
Yeah. So what's easiest to negotiate in getting into the weeds a little bit is the equity stake. And that's something you can be more flexible on because of that point. That you don't know how long it's going to take. You don't know how much money it's going to take. Yeah, you come up with a model, but everything's going to change, and that's why the people are most important that you're working with, so you can adapt and figure that out. And that's why the most pressure I put is on the royalty, because I'm either going to tell them that's either going to disappear later if you really want it, but you should just push it down now and go for equity, and you want to maximize that equity because that's where your returns are going to come from. But that's my view. Feel free to add on.
I'm just going to maybe give a little bit more serious answer to your question. I think for all things, there's a sliding scale, right? And that scale slides based off of what we feel is going to make the company and the venture successful. And investors are part of the equation. We don't want to upset all of the investors because then they don't want to work with us going forward, and they come to us as late as possible in venture creation. So I think what we want is we do want to find the right balance. To your point, we want the balance between the founder, the investors, and the university as much as possible to be on the same team and set up the venture for success. Because I think from the university perspective, the success rate, unfortunately, is low for any product getting to market. And so we need to do collectively a good job at putting together the team, inclusive of all of us, to improve that chance of success.
Right. So, so I think that because Gil is up here, we're allowed to go. No, we won't go over our 5 minutes.
I think actually my session was the only one that went over, so you're definitely allowed to.
So we're closing in on the end of this. So it occurs to me that we talked about having the entire ecosystem, and it occurs to me that we actually did leave out getting a good representation of the tech transfer office staff in here, except for up here. So without them in the room, let's talk about the faculty, since there are some faculty in the room. So on this group, and we'll start with you, Firas. What do you see as the ideal role of the faculty investor, of the faculty inventor, and how does that evolve over different stages of the maturation of the project?
Yeah, this is a long-standing question. There's a lot of different answers, but in the very earliest stages, and I alluded to this earlier, there's little money, and so there's a lot of bootstrapping going on. So between the three stakeholders, you have to kind of assess. The founder has to assess for themselves: are they capable? Do they feel like they have the wherewithal, the permission from the university, and the ability, the skill set to run with this in the earliest stages as the CEO or whatever the head position is called in that particular company. And some do want it and can do it, and some don't really want it. If it is that choice and the founder leads the privatization of the company and is allowed to continue in that role, that's optimal if they're really good at it to a point. And I think as you get to Series A or maybe a little beyond that, you probably would need to identify a professional And then the founder might then, of course, stay with the company, but maybe step back into a chief scientific or chief technical officer. That's kind of a common way this goes. Series A seems to be realistic. The alternative is if they're not capable, if they feel they're not capable, who's to judge? They have to know for themselves, or if they're not allowed, that becomes a big challenge. You then have to use the funds you have to maybe have part-time people. And the way I view it then is you don't really need necessarily someone called a CEO, but you need an operator, somebody who's going to take meetings with investors and with IP attorneys and with university tech transfer offices while the founder's still trying to develop the asset. That's a harder thing to do and to identify those people because they're busy, but maybe part-time contracting type work then.
Yep. That's great. All right, so we're down to the last 2 minutes and 38 seconds. So starting from, big top line, lab to launch, what are critical lessons that you've seen over the years? And we'll start with Gali and run through.
So just to quickly go on to the faculty sort of perspective, and that'll be my last comment. What we're trying to do is help assess and kind of create a phenotype for the faculty innovator in terms of their appetite for risk, their desire for control over the company and the technology, their economic appetite for upside personally, and how those three different factors kind of influence what pathway and journey they're going to take with this project, whether they just throw it over the fence or they participate as an active innovator in the startup company and beyond. So we're creating AI tools to help try to extract and sort of paint a picture of the future of what the life cycle is of this technology and try to identify and assess ego upfront and extract it from confidently held misinformation that the faculty members come in with. That's a tall order, but if we can figure that out, I have a strong thesis that it'll help all the conversations downstream in terms of how we move these things forward.
I'll just shift focus to a topic we haven't talked much about, and that's the role of industry as a partner, even in seed stages. So I have a privilege of working with the Alcon Seed Fund. I think it's a very powerful model, and we're probably the most active seed investor globally in ophthalmology today. And I think there's a lot of value that comes from those types of partnerships because you're dealing with a company with 80 plus years of history in ophthalmology and singularly focused in this space. So there's a lot of in-kind value that comes just beyond capital, and it's non-dilutive capital. So I would definitely encourage those of you in academia to really consider partnering with companies or industry early on. And the fact of the matter is that very few companies really in the life sciences broadly scale to be commercial. It always ends up in some form of licensing or acquisition. So that's one of your most important customers. So building a relationship with that key customer early on in the process is critical. So that's one thought.
Oh, good. I always think that ideas are plenty, and I think oftentimes faculty felt that this is my one and only ideas, and they're so clinging to it. At the end of the day, what makes company win or break is execution. And oftentimes, your idea started with one thing, and what makes them successful is completely doing something different. And I think it's oftentimes it takes a different kind of personality. So knowing what your strength, if that's your strength, is focusing, come up with new ideas, new research, focus on that, and let your students maybe who have the grit, who have nothing to lose, to start the company rather than you start the company.
That's great.
Since we're out of time, I'll make it real fast. When we looked at our successful winners back at Interwest, most of them did not hit their original investment thesis, and they had to change along the way. So I think that was a big lesson for us, that you need a great team that can change along the way.
Drug development's not linear. It's not a straight path. There will be setbacks, and you overcome the challenges with a good team.
Yeah, I would say put all the time and effort that you can into the team building part of it, because the upper and then later middle management people for your company is the face of the franchise and does really all the talking for you, and they must be aligned and, in my opinion, excellent to deliver.
And I'll say, it goes back to the team, but I think look for mentors out there as an innovator. I think the university struggles with trying to promote serial innovators versus entrepreneurs. Those are two very different things. And those that have the background for entrepreneurship, I think is important to bring them in as mentors, and they can provide a lot of guidance because the mindset in academia is very different from the deliverable-driven milestone mindset of getting a company, making it successful.
As promised, tremendous insight. Thank you so much.